Now, we've talked about this, and I know you consider yourself a health futurist. And you even mentioned a few times here that application of energy, vibrations, frequency, light therapy within the beauty realm. Can you go into some of the things? I know you even mentioned biocharger a second ago, but can you go in some of the things you're utilizing in that field and what you've seen by bringing in energy into the equation? Because I do think it's so pivotal, not just in healing, but actually in rejuvenation. What have you seen?
I certainly foresee that there's actually a sci-fi movie, and it's funny how things get kind of put into those type of sci-fi movies, and then sure enough, it's like the tricorders on Star Trek, right?
Yes.
Let's do a little scan. Here's some feedback for you. Poof, there you go. Right. There's been some really cool research coming, two papers out of Stanford on the topic of photobiomodulation. So this is actually an epigenetic change through light energy. So let's just like geek out for a second here. So there's a laser on the market that uses broadband light, that the light is attracted to a target in the skin. That's called chromophore. The target can either be melanin, like your brown spot, dark hairs, also great for hair removal in some skin types, not all. And then on another target is actually hemoglobin. So we're thinking red, right? Broken capillaries, diffuse redness, red acne scars. So the light energy is looking for those chromophores. It gets absorbed, and then it just kind of breaks it down. It gets like, it injures that tissue target, if you will. Then your macrophages come in. They do the job, clear things out, either from the surface out or from the inside. It's pretty neat how these mechanisms can play out depending on the layer in the tissue. So to bring it back to some of the epigenetic studies with broadband light, they looked at, these are two Stanford studies. You can just look this up, BBL Stanford, you'll find it. So clients in their 50s, they compared to clients in their 30s. So, when you're looking at, I believe it's electrophoresis, when they're doing the DNA studies, if you've ever watched CSI, they're trying to pinpoint, who was the murderer, right? We got their DNA. We have that information. And there's these little lines, right? Some genes get turned on and off as we age. So when you're looking at a 30-year-old versus a 50-year-old, it's almost like the script gets flipped, right? The skin cells start to basically their life cycle starts to slow down the older we get in the 50-year-old. So what they noticed was when the broadband light was applied to the 50-year-old skin, the cells actually started to behave more like the 30-year-olds, which is so cool. So this is just very promising. Not only are we seeing light impacting, creating like younger functioning cells via the mechanism of epigenetics, I definitely see that we could use light in many other applications in our bodies for promoting, healing, maybe sometimes promoting just like a little bit of a controlled injury to then get the body to say, hey, let's make some fresh collagen and elastin and turn on those fibroblasts a little bit. So I definitely think the future is going to be with light energy. It's going to be through feedback. There's actually a beauty quark experiment that was done through LHC. So I'm things that happen through those types of large scale studies do end up playing out in more of like a commercial consumer application. So I'm really excited for what's next, but that's pretty well in the rejuvenation space, some of the most cutting edge information and plays between light energy and getting our cells to actually behave younger.
Yeah, I am so bullish on light therapy in general across anti-aging and medicine, really pushing the boundaries what is possible. Because really, as we look at it, even here, we have so many different light therapies here at our center, from plasma light, full spectrum, spectronic kind of infrared and UV light, all these different things that you could apply on the body in different ways. And it's really beyond the application of wavelength, it's also information to the cells. And once you get those cells to regenerate properly, they start to build, and you actually have a healing, and you get lots of things that were dysfunctioning to function properly again. And think about it, it's just applying light. It seems so simple, but the right type is just right information for your body to then cause either a kind of youthful appearance and reaction, or regenerative reaction. So it's so cool. And I think we're just, touching the tip of the iceberg really in what we can do. And like you said, I really foresee little scanners like, going over you like
Tricorders, yeah.
Star Trek in this all the way and being able to not only provide information, but hopefully assess information too. And get, because we, of course, give off light too in biophotons.
We sure do. And by the way, before we geek out on that,
Yeah.
yeah, more energy isn't always better though, as well. So when we're
Oh, no.
seeing these red light devices and they're trying to position themselves as being better because they have a higher joule output, doesn't always mean it's better, because there's kind of like a therapeutic range for
Absolutely.
joules and energy. And yeah, I have a reader right behind me right here. I stick my fingers in here, then it extrapolates the light that comes off my fingers.
The biowell, yes.
A program that I get to see my human biofield.
And that's a really cool thing that people overlook. We all
Totally.
have this. We all are emitting light. We don't see it normally. Some of us maybe give off a glow or an aura, but this is something
radiance.
that is radiance in a sense. And I think that was a question you had for me, like, what is radiance? And I believe that we both agreed it is sort of this idea of your biophotons being in complete coherence and actually radiating and giving off this sort of glow that is energetically felt and could be assessed through things like the biowell.